is just your general setup, okay? If you ever needed to have a setup really quick, for whatever, you can fall back on your K-Pack rat setup. However, for certain procedures, you can use a certain setup just for that procedure, okay? This is one of the ways to set up for appendectomy, okay? If you see or find a different, easier or faster way to set up for appendectomy, use it. But at least you got this, okay? All right, so as you look at it, okay, we got our marking pen, we have our medication, we have our blades, okay? We have our scissors and forceps. All of that stuff is per normal, okay? We have our Kelly clamps. That's going to be for our muscle, to split the muscle, okay? Next, we have our Coker-Ossners. That's going to be for our fascia layer. We have the Babcocks, right? That's going to be for when we retrieve the appendix. And then lastly, we have our Peon clamps to crush the base of the appendix, okay? We have our USA retractors, which is all we're going to need. We have our lap sponges, and then we have our emesis basin, and that's going to be where we're going to put all of our dirty stuff, okay? Now, in anticipation of our dirty stuff, we have our sutures. Our sutures here are laid out this way. As I look at it, the suture closest to me is for the deepest tissue layer. So this would be for the peritoneum, muscle, fascia, subcu, skin, okay? Obviously, these aren't the correct sizes, but this is how you would lay that out, okay? So in my head, the one closest to me is for the deepest tissue layer up to the skin. If it makes more sense, if you look at it from the skin to the deepest tissue layer, it's the same thing, whatever's easiest for you, okay? Now, because for the appendectomy, we are going to be using a purse string stitch. What I've done is I've used a towel and I have my purse string stitch loaded and ready to go. Now, the reason why I have it on a towel is the purse string stitch is part of the dirty portion of the program. So that way I can touch just these two instruments without contaminating anything else. That's why I have it there. And again, once we get to that part of the procedure, it's gonna make more sense, okay? Any questions on that? No? Okay, cool. So, I want you guys to imagine I am gowned in glove and I have on 2 pairs of gloves, okay? So, when Dr. Alegria comes in, I would have 2 pairs of gloves for her, okay? So, normally I would have my stack set up right here, okay? The reason for that is this. When she walks in, okay, I can cut her off, okay? As I take a step towards her, she has to stop. Otherwise, she's gonna bump into me and now I'm contaminated, right? The reason why I do that, stuff like that, the reason why I do that is this. If I keep this here, okay, and she walks in, okay, now, you see how close she is to my field, right? If she comes in hot, right, and she's not paying attention, she can contaminate my field, right? So what I want to do is I'll bring my stack up to my mail stand, and then if she comes in, I cut her off. She's gonna have to stop, okay? So I take the towel, I protect myself, okay? Introduce myself. Hey, I'm Trevor, I'll be your tech today. I'm gonna drip this over her hand. She'll start to dry herself off, okay? I'm gonna grab the gown. Do not unfurl the gown until she gets rid of her towel. The reason for that is they might have an overhead page, Dr. Kaylin, emergency in room, whatever. If she leaves and I have this open, now I'm stuck, right? So she gets rid of it, okay? Now I can open this up, okay? So open it up, lightly jog it, okay? I'm going to protect myself. Okay, now, quick pause. I'm gonna go to her shoulder. Once I get to the shoulder, I'm going to flip like that, okay? What I don't wanna do is, what I don't wanna do is I don't wanna do this. For 2 reasons. One, her back is unsterile, right? And then two, I can't see my fingers. That makes sense? Does that make sense?
Yes.
All right. So go to her shoulder and then just flip. Okay. The circulator is going to tie her up in the back. Oh, you're fine. Stay where you are. Okay. Now, as soon as I go to her shoulder and I flip, I'm going to grab the sleeve. Don't grab the cuff. I'm going to grab the sleeve and I'm going to slide the cuff down to either the bottom of her thumbnail or the middle of her thumb. Just eyeball it. Okay. I'll do the same thing on the other side. Pull this down to about the middle of her thumb. Right? All right. Cool. So, when you put the gloves on, okay, always start with the right glove first. It's just habit. Most of the doctors you're going to be working with are right-handed. I'm going to pull on the fingers to separate. Open up the glove. Make sure the thumb is pointing towards the doctor. It should look like this. Okay? Now, for me, I'm going to tuck my fingers underneath and pull my thumbs apart. Okay? If it's comfortable for you, you can tuck all your fingers under and pull it apart. For me, it's awkward, so I just tuck my fingers under and pull my thumbs out. Okay? So, what Dr. Kaylin's going to do, she's going to get her fingers started, and then she's going to do like a J or a fish hook. She's going to go down and then come up. When she comes up, let go of the glove. Otherwise, when she comes up, she's going to take me with her. Okay? All right? So, here you go, right glove. Just like that. Now, you notice that her thumb, that's on her. Right? I held it open, that's on her. Not a big deal. She will fix that after she puts the second glove on. Okay? Again, pull on the fingers to separate. Make sure the thumb is facing the Dr. Kaylin. Now, on the second glove, she's going to help herself. Okay? She's going to, yeah, just like that. Same thing. Fish hook, let go as she comes up. Okay? Cool. Any questions on gowning and gloving the doctor? Okay? Now we're going to do sterile to sterile dance. Okay? So, Dr. Kaylin's going to grab the dance card in both hands, left string in her left hand. I take the dance card and she is going to spin. She grabs just a string. This is sterile now. Okay? If you dance sterile to sterile, your dance card is sterile. Keep the dance card because you can write notes on it. All right? So I'll just take this and I'll just set this on my mail stand to write notes later. Okay? Now, if she were to dance with the circulator, she could not use that dance card because the circulator is not sterile. That make sense? Yeah. Everybody good?
Yeah.
Cool. Also, if you want to, your glove wrapper, you can also use to write notes on it if you want to. Okay? So you can just set this here, and that can be for writing your extra notes. All right? Everybody good? Okay. Now we're ready to drape the patient. All right? So, magically sterile. The circulator is going to turn the lights on. Sweet. Okay. All right, cool. So, I have the large drape sheet. This is going to cover the legs. We're going to start off with the patient. Okay? I'm going to hand one end to the doctor, just like this. Quick pause. So, this is going to be my level working surface. Okay? Do not let the drape sag. No, you're fine. Do not let the drape sag below this level surface. Okay? What you want to do is hold it like in the middle of your sterile box. So something like this. Okay? All right, with this hand, okay, we're going to open this up, protect ourselves, and we're going to walk this up to the edge, just like that. Okay? With this hand here, we're going to hold this down, protect ourselves. We're going to go as far as we can and just let it drop. Okay? do not follow it down, okay? If you do follow it down, you have to stop at that level of working surface, okay? Next, I take my towels. Per CST, the tech stands on the same side as the surgeon, okay? Using my index fingers, I'm going to push out the first towel. She's going to take it, okay? And she's going to cover in front of her first. Why? Because this is unsterile and she's creating a sterile area, okay? When she sets this down, it's going to be set, flip. That was perfect. All right, awesome. Okay. Now, once she does this, okay, she has options. She can either cover inferiorly first and then superior, or cover superior first and then inferior. All right, don't do that. All right. So, real quick. Earlier we talked about where we're going to be working, okay? So we're going to divide the body into regions, right? Gather around. Okay? We're dividing the body into regions, okay? So we talked about it earlier, okay? What region of the body are we going to be working when we do this case?
Right iliac.
The right iliac, aka right inguinal region, okay? So this is the area where we're going to be working. When we square off the incision site, we're going to cover the entire abdomen except for this square. That makes sense? Okay? So the next one she's going to put down, if she puts down the inferior one, she's going to cover this bottom part. The third, she's going to cover all the way up to here, okay? And then the last one I'm going to put on, and I'm basically going to cover it here. So all we're going to have left is just that bottom square there. That makes sense? All right. So we have the right inguinal region, aka right iliac. This is the right lumbar. This is the right hypochondriac. Okay? Whatever's on the right side, we have on the left side. So this is the right hypochondriac. We have the left hypochondriac, left lumbar, and left inguinal region, aka left iliac region. Okay? The majority of your stomach is at the top section of your, this is your umbilicus. This is the umbilical region. All right? The majority of your stomach is in the top portion of the umbilicus. So this one is your epigastric region. Okay? This is the umbilical region, and this one's below the stomach, so this is the hypogastric region. Okay? Now, we always use regions when we talk about areas of the body because it's more specific. Okay? If we were to use quadrants, all we're doing is just making a giant T, and then we have 4 large sections, okay? That's too vague, right? The reason why we want to use regions as a tech is that, and as we talk about this more, major structures are primarily in certain regions, right? For example, if Tech Jennifer gets a call one night, hey, we got a motor vehicle accident, okay? And we have a lacerated spleen, okay? We know that the spleen is in the left hypochondriac region, okay? We also know, because it's the spleen, we know it's highly vascular. So right away, I know I need a major tray and I need a vascular tray. Right? I'm also gonna need some hemoclips, ligament clips. Okay? Knowing what region you're working will give you a heads up as to what structures are in that region. All right? And that can lead you to the instruments, the procedures, that sort of a thing. Right? That's why we use regions and not quadrants, because it's more specific. Okay? Cool. So any quick questions on that? All right. That was excellent, by the way. So, I get the next one ready. Okay. I get the third one ready to go. Yep. Cool. Now the last one I'm going to put on. So I walk over here, okay, and I'm going to cover up this line right here. So I'm here, set, flip. Okay. So it should look like this. The only area that's exposed is that right inguinal, aka right iliac region. Okay. All right. Any questions on that?
In real life, you told us you would have to cut back the towel.
Right. So in real life, if I come in too hot, right, and I cover up this, I cannot take this off. I would have to cut around this. Okay. Cool. All right. So now we're going to take our smaller drape sheet. Because we've covered the legs, now we can both approach here safely. Okay? I give her one end. Now we're going to slide here together. Okay? This end here, we're just going to set this down, just like that. Okay? Hand goes here. Protect ourselves. And now we can pull this as we need to, right? And just let that drop. Okay? Now this is going to be covering the patient's face. Don't worry about it because anesthesia is going to take care of that coming up. Okay? Last thing, I have my final drape. Okay? This is a simple laparotomy drape. Okay? I'm going to peel off these little plastics, right? Put that in the trash. So as you look at it, okay, I'm going to come away. So we have a diagram, an outline of the body. Okay? Remember, head towards the head. Okay? Head towards the head. Head towards the head. Okay? Head towards the head. So I'm going to peel off these stickies, put that in the trash, and then when I set this down, right? Come over here, Joanna, so you can see. All right. So as I put this down, okay, the head is pointing towards the head. Can you see that? All right. So you see where the head's pointing towards the head? That's how you want this, okay? Now, on some drapes, you may not have the silhouette of a body, but you will have the word head with an arrow and feet with an arrow, okay? So whether it's the silhouette or the words head points towards the head, okay? So set that down. I give this one end to Dr. Alegria, okay? This hand goes here. I like saying it. All right. So, where's the edge of this thing? Okay. Yeah. Cool. So protect ourselves. We always cover the legs first. Go as far as we can. Let it drop. Now you see how this is kind of funky. I can come back and smooth that out as best I can. Now tech tip. So let's say I'm smoothing this out. The end of the bed is like a runway in the airport. I come here, I come up, right? I don't do this. Why? I'm below my level working surface, number one. Number two, I can't see my fingers, right? So if I smooth it out, I come up, okay? Switch hands. Now, on the final drape, okay? We're gonna give this to anesthesia, right? Since you're there, you're anesthesia, all right? Protect yourselves. Pause. You see how Kaylin's hand isn't covered? Okay. Now the reason why we do that, you see how Dr. Joey is grabbing over the top, right? Grab here, just for S&G, yeah. Right? So if he were to do that, okay, he can touch me, but he's not contaminating me. That's why we protect ourselves. Okay. So.
Oh, because your hand's underneath.
Because my hand's underneath, right? Now, normally what he would do is he would just grab one side at a time first. So he grabs my side first, you would just stay there until he takes your side, right? He takes his clips, and you'll just take that off. Yeah, take that off.
Oh, okay.
Right, and you'll just wrap this around like this, and just clip it. Yep. Yep. And yeah, we'll take that. Okay. Now, okay, pause. Normally, what he would do is, instead of reaching over top, he would just pinch underneath and grab it. But that's all right. All right, cool. All right, cool beans. Okay. So, everybody cool with how we did this? Any questions on that? Okay. Tech tip. In your basin, you're going to have your suction tubing, your bovie, and your light handles. Right? The light handles that we have don't fit these; they would fall off. But in a real set, you would. Okay? Take your suction, your bovie, and your light handles, and we're going to set this down in front of the doctor. Okay? In the real world, Dr. Kaylin, right, will start setting stuff up. I do this to keep her occupied, because now I'm going to come over here and bring up my mail stand first. We always bring up our mail stand first. Okay? So, notice what I did. I came here, stepped to the side. 2 reasons. I can still see my sterile field, and also I never want to do this. Alright? I don't want to back up, because now I don't want my unsterile back to potentially bump into this, and now I've contaminated. That makes sense? So step to the side, just grab the edges, and you will be able to easily move this. Alright? It's not going to be an issue. So I'm going to come over here. Okay? Now to lift this, I just need to just pull up on it. Okay? If I want to lower it, 2 things. 1, hold on to the tray. Okay? Then I can go ahead, step on the button, and then I can do this. Alright? I don't need to step on the button to raise it up. I need to step on a button just to lower it. Okay? So I bring in my tray. Tip. You want a 2-fist clearance under your mail stand. So, all right, I got a little bit of space, right? So approximately 2 fists, right? So we're good to go, okay? I'm gonna go to my back table now, okay? Flat hands on top of my table. I'm gonna swing this over like this, okay? Do not do this, okay? 2 reasons. 1, my hands are low to my level working surface, okay? And 2, I can't see my fingers, okay? Don't do this. Hands on top. Swing it over. Now, I'm going to go corner to corner. Corner of my table to corner of my mail stand, okay? So, swing over here, okay? So, I'm going to go corner to corner, okay? And then, I'm going to put my table on a slight 45, right? Something like this. Here's why. The reason why you want a slight 45 is I want to be able to get to that far corner if I needed to, right? As slight as this is, if I was at a straight 90 degree, okay, it could be difficult to reach back there to get that towel in the back corner, right? However, if I put it on a slight 45, now it's much easier to get that towel. It really is, okay? So, you want a slight 45. Do not put it on an extreme 45 like this. Here's why. If I'm standing at my mail stand, my back is all over here. Does that make sense? Okay? So you don't want an extreme angle, you want a slight 45. Okay? So I come back, something like this. Now if I stand here, my back is nowhere near my table. Does that make sense? All right? Any questions on what I've done so far? Okay? On my basin, okay, again, hands up top. I can put my basin here, or I can put my basin here. It's up to you. Okay? Now, I'm in the habit of not having anything behind me, so I put it here. Okay? But again, my hand is on top, right? Or inside. Do not do this. Okay, again, I'm below the level surface of my basin, number 1. Number 2, I can't see my fingers. Okay? Certainly don't do this. Okay? Hands up top. I can put it here, or I can put it here. It's up to you. Okay? So, a couple of things before we start. I know for this appendectomy, okay, we're gonna have a dirty portion of the procedure. What I've done is I've taken a towel and I've taken a needle holder that I'm not gonna use again, and I've taken a forceps that I'm not gonna use, and I've isolated it on this towel, okay? That allows me to touch this without contaminating anything else. Okay, that makes sense? Right? It will. All right, so back to here. Any questions on how we got to this point?
Is this in use anymore, or is this just done?
The nurse would take that and get that out of the way. All right, cool. All right, tip. So on your suction tubing, you're going to take an Edna clamp and you're going to clamp your Yankauer tip, suction tip. Okay. You're also going to take an Edna clamp and you're going to clamp the Bovie cup holder. Okay. Also, if you have your scratch pad, take your scratch pad and just attach it to your Bovie cup holder. Okay. Now, the first thing we set up, the last thing we take down is the suction. Why? In case the patient aspirates, we have to evacuate immediately. First thing we set up, suction. Last thing we take down, suction. Always. Okay? So, now, as a general rule for both your Bovie and your suction, you want to be able to go from nose to toes. How do you do that? What you do, take your Yankauer, you're gonna go 2 arms length of your arm length, right? So I'm here, 1, 2, okay? Now, as my hand goes out, my head goes out, okay? So, I have my length with the opposite end. I'm gonna create a tail, and then I'm gonna lean in and give that to my circulator, okay? Now, the circulator takes it, I can control how much of this I can give. Okay, cool. All right. Now, if I didn't have, no, you're fine. All right. If I didn't have the Velcro straps, that's why I have my Edna clamp. Okay. All I'm going to do is create a pouch. Okay. All I did was create a little pocket, okay? And I'm going to pinch the top of that pocket, okay? Come here close, okay? What I don't want to do is I don't want to pinch deep, okay? If I pinch deep, what I'm doing is I'm including that suction tubing. Does that make sense? Right? So if I pinch deep, right? Now you're going to be able to feel that resistance, meaning you've got the tubing, okay? So create a pocket. And I'm gonna clamp the top of it. The finger rings are away from my sterile, from the air, my surgical site. Okay, that's the general rule. Okay, now if I have Velcro straps, I will use those instead. Okay, I'm gonna open it up, take my suction tubing, and then I'm going to tightly wrap this around my tubing. See how I did that? Okay. Now, if I do this tight, it has less chance of sliding. If I do it loosely, like this, okay. Now, you don't want to have it loose like that because your tubing can migrate during the case, for example, and then before you know it, you may end up with something like this. Okay. If this were to happen, okay, I cannot pull this up. Why? Because now I'm going from dirty up to clean. That makes sense? Okay. So, which is why if I were to use the Velcro, I'm going to wrap this tight, just like that. Okay. Less chance of it migrating. Okay. Cool. Now, I can also use this, same thing. got it here. Now, I still have this over here. Now I can use my Edna, okay? So, I'm just gonna create a pocket, okay? You guys can see here, just create a pocket. And again, I'm gonna clamp this at the top, and we're good to go, okay? Now, some laparotomy drapes have pouches. Pouches are even better. Now I can just stuff this in the pouch and then tuck this in the end and I'm good to go. Okay? Now, nose, toes. All right? I have more than enough length. All right? That makes sense? All right. Now, your bovie. Okay? Your suction tubing is first, bovie is next. There's a couple ways that we can do this. First way, hey doc, where do you want your bovie? Okay, so doctor says she wants it right there. Okay, what I'm going to do, take this, I'm going to clamp the drape and the cup. Okay, all I'm going to do, again, finger rings away from the field, but I'm going to make sure that I get the drape and the cup, just like that. Okay. Now, far as the bovie pencil is concerned, same thing. I'm going to be able to go from nose to toes. So, 2 arms length. 1, 2. Give that off to the circulator. Okay, and again, I can control. Just let it drop. Okay, now, for this one, I'm going to use the same Velcro that I have here. Just make sure that this is tight to both. We're good to go. Okay? If I need, I'm going to wrap this underneath just like that. And I can also take this and create my, now, I use this for my cup. What can I do? I'm going to take a non-perforating clamp. What does that mean? I can take a Kelly clamp. I can take a straight Kelly or straight cryo. Just clamp this right on top. Just like that. Okay? And now I have more than enough length. Nose, toes. And I'll just tuck this in there just like that. All right, that's option 1. Option 2 is this. I'm not going to ask her where she wants it. What I'm going to do is I'm going to take my bovie cup holder, lift up on the tray, tuck this in, and I'm going to just push this down. So now this is caught between the tray and the frame. Okay? And so now I can just put my bovie here. And I will still create a pocket for the bovie cord. But now instead of using an extra Kelly clamp, now I can use my Edna clamp. All right? Just like that. Okay? So you have options. Okay. Any questions on what I did or how I did it?
What's the scratch pad for?
So this is this is Teflon coated, but some of your bovie tips are stainless steel, right? And if it's stainless steel, I use this to kind of scrap off the char. All right. The Teflon coated tips are like non-stick, so in theory you should be able to just wipe this on the drape and it'll slide. Whatever material should slide right off. Okay. All right. Any questions on what I did or how I did it up to that point? We good? All right, we're almost ready to start. I'm going to take 2 lap sponges, open them up lengthwise. I'm going to frame the incision. All I'm doing is just putting 2 lap sponges on both sides of my incision, of our site. Okay? Of course, we have our light handles, and then we will aim the lights where we're working. Okay? All right. Cool. Okay. All right. So once we get to this part, okay, now we're ready to do our timeout. Okay. Anybody in the OR can initiate the timeout, right? So the tech could do it, anesthesia could do it, the doctor could certainly do it, the circulator could certainly do it, right? Doesn't matter who does it, someone's going to start it. Normally, it's the circulator that does it, okay? So what are we checking for? We're checking to make sure we have the correct doctor, correct patient, the correct procedure in the correct site or where we're working, okay? Patient identifier, typically the medical record number, and then lastly, any allergies. It's gonna sound something like this, all right? All right, timeout, all right? This is Dr. Kalin. We're doing appendectomy, patient John Doe, patient medical record number 1, 2, 3, 4, 5, 6, 7, 8, 9. We're in the right inguinal region and no known allergies. We good? 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 It's that quick, okay? Everybody signs off on it so that we're good to go, okay? So once we do the timeout, now we're here on the mail stand, and everything is in order, as you're about to see, okay? So first thing we do, I'm gonna pass her the marking pen, okay? I'm holding the pen by the cap, all right? Quick pause. I am the king of sterility. You guys are kings of sterility, you're king of sterility, you ladies are queens of sterility, all right? It does not matter who is in the room. I, as the tech, I am in charge of who gets close or closer to my field, right? Sherman is a bit close. Aspen is a bit close, right? No, stay where you are, all right? But I'm glad you're there. So in the real world, I would tell you guys, hey, just take one step back, right? And then they would, okay? Even with everything else going on, okay, it is our responsibility to not have anyone, compromise their field, right? Because that's violation of principle number 3, right? Movement in and around the field must not compromise the sterile field. So, what do I mean by that? We're constantly have our heads on a swivel, right? Now, why am I saying that? I know it's a tangent. You're gonna have visitors in your room, right? You may have medical magnet students in your room, high school medical magnet students in your room, right? High school medical magnet students and first year residents are like caffeinated puppies, right? They're hyper as hell and they want to get as close as possible, right? Now, I may tell you to stay at the door and eventually I look up and holy shit, you're both right here, okay? It happens all the time, right? So, what you need to do is take one big step back, please, right? And then every now and then I have to make sure that they're not, because they will creep forward. It's like Simon says, or freeze tag, you know what I mean? All right? So, I said that to say this, just be aware of who's around your field, all right? So, I'm gonna hold the marking pen by the cap, okay? And now, we're about to draw our incision, okay? CSC question. The incision most associated with appendectomy is McBurney incision. CC question number 2. The type of directional incision that McBurney's is an oblique incision. Oblique is French for diagonal, or fancy way for saying diagonal. Okay.
Doesn't matter which.
So we're gonna run this way. All right, cool. Now, awesome. Now, what did we just do? What happened was I just created a phantom neutral zone, okay? Even though this is a marking pen and it's not gonna hurt me, okay? Anything that's in the doctor's hands, okay? Allow them to set it down, their hand moves away, then I can come in safely and get it, okay? Especially knock, knock, knock with anything sharp. Let them set it down, move their hand away, and then I can come in and get it. Do not take a sharp from a doctor. Someone's gonna get hurt and it's gonna be you, all right? Now, tech tip. You may see the doctor do this, right? Make these little hash marks, okay? These hash marks are so that when we close the skin, we can approximate these and line these up again so that we have a nice closure. That's what the hash marks are for. All right? So Dr. Kaylin made a straight line, and then she came in and she did this. Right? That's just to help the doctor make a nice straight closure when we're closing the skin. Okay? Cool. All right? So we marked our incision. The next thing is, Doc, do you want to inject now or inject later?
Later.
Later. Okay? Now, if she doesn't inject now, okay, when we get to the sub-Q and or fascia layer, that's when you remind the doctor, hey doc, don't forget we got to inject. Now, why did she want to wait? She wanted to wait because she wanted to prolong the medicative effect of the medicine, okay, such that even after the patient wakes up in recovery, they still have pain meds on board, which means she's not getting a call an hour after the patient goes to recovery. Oh my God, I'm in pain. That's why they do it, right? Now, CST question. This particular medication, which is lidocaine, has epinephrine in it. Don't say anything, because I know you know. What effect, CST question, what effect does epinephrine have on medication?
Is it the vasoconstrictor?
So epinephrine is a vasoconstrictor,
Yes.
but what does that mean?
That means it constricts, like the blood around the area. Like the
It constricts the vessels,
vessels. Yeah.
which in turn does what?
It slows down the blood,
Holds it in the tissues longer.
holds it in the tissues longer.
All right. High five. No, I'm sterile. All right. Yeah. So epinephrine is a vasoconstrictor. Okay, meaning the vessels constrict. It holds the medication in the tissues longer, which prolongs the effect of the medication. Okay.
Well, it's the same thing that people take when they have like a allergic reaction or whatever.
Yeah. All right. Cool. Cool. All right. So we're gonna wait on the medication. Okay. So if we're not going to inject right away, right? So, but I'm gonna show you how to do this anyway. Okay. So take this. Put a little angle. You're fine. Oh. So what you're gonna do? You're going to insert. And we're going to inject, right? We're going to inject along the length of the incision.
So you would do that, not the doctor?
Oh, no. The doctor does this,
Okay.
right? Under no circumstances will the tech ever inject medication, right? I'm tech/Dr. Doyle, right? Under no circumstances will the tech ever inject, ever. So, if you do use medication, okay, once the doctor is done, okay, the top black ring of the plunger, that is where we read the medication. So in this instance, we used 6 cc's of local, okay? That makes sense? See that here? So you're gonna read that
We
top.
started at 10, right?
We started at 10, and we used 6, so it's right after 4.
Okay.
All right. We started at 10, and that top black ring is at 4. That's where we read it. Okay. Okay. So, CST question. We never recap a needle. All right. I'm going to sheathe the needle. I'm going to use a one-hand scoop technique. Right. That's all I'm doing. Okay. We do not recap it. Now, take your marking pen real quick. You're gonna write down 6 cc's. Okay. You can give your circulator a heads up. Circulator, we use 6 cc's of lidocaine with epinephrine. Okay. Now, if Dr. Kaylin wants to use more, well, I'll just add that to my total if I need to. Okay.
The reason we don't recap, right? You don't want to like accidentally prick yourself.
Yeah. All right. That's exactly right. Okay. All right. So now we're ready to start the case. Okay. for any procedure, we're about to go through the first 4 steps in any procedure, okay? So, because this is a small incision, okay, I'm going to use a smaller blade, right? So, in this case, I'm using my 3 handle with a 15 blade, okay? So, step 1 is knife. So, Dr. Kalen says knife.
Knife.
Okay. My hand's on top. Okay. I'm going to put this right in the curvature of her thumb and index finger, just like this. Okay, quick pause. Tech tip. When you pass a blade, it's going to be on a 45-degree angle, just like this, with the cutting edge down. Do not do this. Do not put it on a 45 with the cutting edge up. Let me tell you why. The doctor has a tendency to go up and out when they take it from you. If you have the cutting edge up, slice. Okay? Always, always, always 45-degree angle, cutting edge down. Now, even if she yanks it from me, it's going to scare me, but I'm not going to get cut. Right? And then I will passively aggressively do shit to you during the case to show you how upset I am with you. Okay? So, she says knife. Anytime you're handling a sharp, let the doctor know what you're giving her. If she says knife, knife. Right? She may say scalpel, scalpel. Right? That make sense? I am not going to let go until she says, I got it, let go, what are you doing? Right?
Drop it.
Right? Now I let go. Okay? Pause. So, she's about to create bleeding. I am going to prepare for step 2, which is what? Stop bleeding. What I'm going to do, I'm going to have the Bovie ready to go and a sponge ready to go. Okay? So, she's going to go ahead and make her incision. Go for it. Stab that motherfucker.
Whoa.
All right? All right, so she sets it down. 1, 2, quick pause, okay? Ideally, you want this hand to work with this hand to work with this hand. Why? You don't want to cross over the field, okay? I'm blocking the field and I'm blocking her field of vision, okay? That could be annoying, okay? You want to keep the doctor's hands occupied. After she makes her skin incision and she sets the blade down, Bovie, sponge, and now I can move this safely. Okay, quick pause. After we make our skin incision, this blade is considered dirty. I can now put this in my emesis basin. Okay, and I can take this and set this underneath my mail stand. Right, nice and safe and secure. It's not going anywhere. Okay. So, any questions on that? Okay, so she made her skin incision. Okay, now you're gonna have little capillary bleeding, so you might have like little pumps of blood squirting through. What Dr. Kayla is gonna do? She's going to buzz and blot. So on your Bovie pencil, aka the active electrode. Okay, the blue button here, this is the coag. The yellow button here, this is cut. Okay, she wants to stop bleeding, so she's going to push the coag button. She's going to buzz it and then blot it. Buzz, blot, buzz, blot, buzz, blot. Okay, and she'll take care of all the little bleeders at the skin edge by doing that. Okay, now, so she's buzzing and blotting. Okay, so then she says, "Hey, give me. I want a Kelly clamp." So I'm going to take a Kelly clamp. Okay, so I give her a Kelly clamp.
Can I put it in the cup?
Yep. I give her a Kelly clamp. Okay, now what she's going to do is she's going to clamp and occlude one of the capillaries, right, just like that. And now she's going to say, "Buzz me." What I'm going to do is take the Bovie. I'm going to tap her instrument. Okay. I'm going to hit coag, and what I'm doing now is I am doing RF capacitive coupling. What I'm doing by tapping this and holding it and pressing coag, I'm sending that electrical current down to the tip of the instrument. Okay? You're gonna hear a little pop, a little crackle, a little sizzle, right? So basically, hold on. So basically, all you're gonna do is hit, touch it, hit the coag, 1001, 1002, 1003. That's normally enough, right? And you might see pop, fizz, something like that. Okay? RF capacitive coupling. Now, do not touch up here. Why? It's too close to her thumb. I don't want to burn her. Just tap here. Tap here. It's going to go straight down to the tip of her instrument. Okay? Do not be afraid to do this. All right? She's gonna clamp it. She'll say, "Buzz me." 1001, 1002. Cool. And then put it back. Not a big deal. Okay? We're neat. We'll just put that back where we got it. All right, cool. So step 1, skin incision. Step 2, all right, stop the bleeding. Step 3.
You grab your scissors and
Okay, pause. So here's why we set this up. Gather around. Everything's in order of use, right? This was the first thing we used. This was the second thing we used. This was the third thing we used. What's next? Your Mets and the Bakey, right? So the reason why you want to set up your mail stand in order of use when possible is even if you brain lock, you can just look and see what's the next thing we're going to use, right? The next thing I'm going to use is my Mets and my DeBakey. Why? We make our initial skin incision, right? Right, skin and subcuticular. The next layer that we're going to hit is the adipose layer. What type of tissue is adipose? Delicate medium tissue. Here's my scissor for that. Here's my forceps for that. That make sense? Right? If you set it up properly, you can kind of put your brain on autopilot. Right? You want to make your setup as easy-ist on you as possible. Okay? But you're correct, right? So I'm gonna pass this, right? Just like that, okay? So now step 3 is dissection. Step 1, create the incision. Step 2, stop the bleeding. Step 3, dissection. Step 4, retraction, okay? With the small ends of the USA. Okay, so she starts to dissect, and as she gets deeper, I'm going to assist Dr. Kalin and just hold this open. Now, when you retract, okay, I'm not pulling on this. All I'm doing is just holding this open, okay? As we dissect deeper, I'll just reposition and hold it open again, okay? Do not pull on the skin edges, okay? So this is our yellow fatty stuff. You can kind of cut through that. So start cutting through it, Kaylin. All right, so gather around. I want you to see this. Pause for a second. All right, so start here. No, start here and go that way. Okay, quick pause. As Dr. Kalin is sliding up this way, I'm gonna slide with her with my retractor. Can you guys see that? Okay, I'm sliding with her. All right, now slide the other way. So as she starts cutting the other way, again, I'm sliding with her. Okay, and then I'm taking one of my retractors to show her that corner. That makes sense? Okay. You want as much as you can. I want to try. So put your instruments in here in the middle. As much as you can, I want to try to have freeze. I want to try to have put your forceps there too. I want to try to have the tips of her instruments in the middle. Okay, that's going to give her the greatest exposure, and she can see what she's doing as much as possible. Okay, and if she moves one way or the other, slide this way. As she moves, I move. As she moves, I move. Okay, that makes sense? Okay, now we get deeper, okay, and I just reposition and I just hold it open. Okay, now go ahead. Yeah, it felt good, huh? Yeah, it did. All right, so she is like, yeah, it did. All right, so we made our skin incision. We've dissected through the yellow, fatty, oily adipose tissue layer, okay? And now we're at the tough, white connective tissue, which is the fascia, okay? So, tech tip, all right? Put it down. All right. Now, do I want to keep putting this back on my mail stand and take it off? Here's what you can do. Take this and put this in your Wilby cup. So now, whenever she needs it, she can just take it from there. Okay? So whenever we get to a layer where she needs her forceps, hey doc, it's in the cup. That makes sense? Okay. Now we're at the fascia layer. Okay. What type of tissue are we dealing with? Tough. So let's go to our mail stand. What's the next item up? Curved mail and our forceps with teeth, whatever that may be. Right. Now, what tissue, what pickup with teeth will I need? That'll be on the preface card. For our purposes today, we're using a rat tooth. Okay. That being said, okay, you always want to have options, right? So let's say that I want to give this to, I give her the scissor, no big deal. Okay. I try to give her the forceps, say no.
No.
She says no. Right now, she says no, like how she said that. No, Ratty.
No.
All right. So if she says no, the tech needs to have options. Okay. All right. Cool. She doesn't want a rat tooth. I can give her a Russian. I try to give her that. Say no.
No.
She doesn't want a Russian. I can give her Bonnie. I try to give her that. Say no. All right. I can give her a Ferris Smith. Right. The idea is we need to know other options. Now on the preference card, it should tell us what she wants, right? But she might have a wild hair up her butt today for some reason, right? She wants to make things difficult. That's okay, right? I have other options, right? You don't want a rat tooth? Here's a Russian. You don't want a Russian? Here's a Bonnie. You don't want a Bonnie? Here's a Ferris Smith. Now, if she says no to all four, Doc, what do you want?
Rat tooth.
Yeah.
Got it.
Yeah, and I will do that, right? I will do that. It's like, the hell? Okay, now, check it. No, real talk. No, real talk. If that happens, now I know that there's something going on here, right? There's something going on here, right? So that lets me know that I might be in for a fun time, so to speak, all right? Because of whatever this is right now, all right? So just deal with it, all right? She might be having a bad day, not a big deal. Okay, cool. All right, so go ahead. Now, tech tip. She's having difficulty grasping the fascia with her rat tooth. Options, go. Right. So again, look at my mail stand. Look at my mail stand and tell me what options I could use. It's not the Kellys.
Do you have your accents?
What's next to the Kellys? Say right there. Say Coco Rossner.
Coke
All right, Coco Rossner. All right. So, if she's having trouble with the rat tooth, I'm going to give her Coco Rossner. All right. So now I grabbed it with this hand. Okay. I don't want to pass it to myself just to give it to her. Okay. I grab it here. I just give it to her like that. Okay. These come in pairs, so she'll drop the scissor for now. Take that. I'm going to move this back and have the scissor ready. Okay. So what she's going to do, she's going to grasp the fascia with the cokers. Yeah, that's fine. Yeah, that's fine. Okay. So I'm gonna take this one. Okay. I'll take this one. Okay. So now I can take this, give her back her forceps, and I'm going to tent this for her. All right? And she'll just go ahead and just cut. Yep. Just like that. Sweet. All right, I'll readjust. Now, once I get beyond the fascia, I can switch to my deeper blade. All right, just like that. Perfect. All right, take these off, put these back. All right, we want to be orderly. Okay, I can take this, Take that back, because now we're at the what? We're at the muscle, okay? We do not cut the muscle, we're going to separate the muscle. You can put that back, Doc. All right? So what do? Now, this is felt, it's not actual muscle. So, your fingers are like muscle fibers, right? So what we're gonna do, we're gonna take one Kelly clamp, okay? She's going to put that in between the muscle fibers and create an opening, right? Something small like that, okay? So we have an opening here. I can take my T-nuts on a Kelly clamp, put that down, okay? All right, and now what she'll do is she'll make that opening a little bit wider, okay? Just kind of go back and forth, yeah? So she's gonna do that, right? So now we have a little wider opening, right? You're good, you set that down, okay? So now what we're gonna do is take the one retractor here, take the other retractor, right, there, right? And now she's going to spread it apart. Now you might hear some tearing when she does this. It's kind of a cool sound, all right? But that's what we can do, right? Now sometimes they'll separate the fibers with the Kelly clamp and then go straight to the USAs, all right? So just be prepared to give the peanut, but you may not have to give the peanut, okay? So for our purposes, let's go ahead and just cut through this, because it's going to take you forever to... Yeah, that's fine. All right, sweet. All right, so again, we're using the deeper blades on this. All right, cool. You got that? So just for a second. All right, so now we've made our initial skin incision through the skin. We've dissected through the sub-Q with our Metz and our DeBakey, okay? We've used our Coker-Oschners to lift the fascia off of the muscle, and we cut through that, okay? With either our curved male scissor, or I could use my clean blade to cut through it, or I could use my Bovie, because we have options, right? We took a Kelly clamp, opened up the muscle fibers, used our USAs, and just kind of pulled it open, spread it apart, okay? Now, the last layer before we enter the abdomen is?
The last layer is peritoneum.
Peritoneum, right? So, I have a Kelly clamp. So I'm taking the Kelly clamp from using the muscle, and I give that to Doc. I'm gonna have my other Kelly clamp ready, just like that. So what she's going to do, she's going to grab the, just like that. Just like that. Now I'm gonna take this from her. Doc, your scissor and forceps are in there. That's why we have those there. And I'm going to just lift this up and tent this for her. Okay? Hello, Mr. Ring. Okay, now why are we tinting this,
So
Joey?
you don't cut into like the organs and stuff.
Yep. Your peritoneum sits directly on top of your abdominal contents. You don't want to just cut into it, because you'll be cutting into the underlying structures underneath. Okay, so these come off. Okay, and again, we want to be neat, so I'm going to put these back where I got them. All right, so now we are in. Okay, we're going to take our lat sponge, and I'm going to cover the incision. I'm doing this because I'm getting prepared. You're fine. I'm getting prepared for our next step. Okay, so we used our Metz and DeBakey for the sub-Q. We used our rat tooth and our curved Mayo for muscle fascia. Okay, we used our Kelly clamps for the muscle. We used our Cokers for muscle fascia. Now I have my Babcocks. What are the Babcocks used for? Sterile.
It's to clamp onto the appendix.
So we're gonna go fishing for the appendix right now. Okay. So I'm gonna give Dr. K, Lynn, both of these. Okay. And now, so by the way, the appendix are blue.
Okay.
So she's gonna go in and she's going to,
This.
yep, find one of those bad boys. Okay, now normally she would be taking out a little bit of intestines, right? All right, so go ahead and take those and see if you can find one. Okay, so she found one. So she found the appendix. So now she's just going to take this and pull this out. Okay, cool. All right, so you're fine. Keep that one on. So once we have the appendix, the second one can come off. Okay, and now we have this. Okay, so basically we have the appendix exposed. Okay, so your appendix is in blue, but you get the idea. Okay. Oh, do me a favor. Can you go where it says Addison kits, Joey? Right there. And free ties. Can you give me it? Thank you. Okay. I knew I forgot something. Contaminated, but
Magically clean.
all right. Here you go. All right. So now we have our appendix. Okay. Now this is normally like an orangish, yellowish, reddish color. Okay. This is our mesoappendix. Okay. The mesoappendix is attached to the underside of our appendix. Okay. The mesoappendix helps to supply blood and nutrients to the appendix. Okay. So once we have grasped the appendix with our Babcock, okay, because it's designed to grasp and hold and not crush, the first thing we need to do is we need to take down the mesoappendix. Okay, 2 ways to do it. Okay, the old school way is there's 6 steps: clamp, clamp, cut, free tie, cut, clamp, clamp, cut, free tie, cut, or Kelly, Metz, free tie, suture scissors. Okay, so let me show you what that means. So, Dr. Kaylin, give that to her. Give that to her. Okay, and what she's going to do is she's just going to just clamp right here. So she's going to clamp here. Yeah, she's going to clamp the other one facing that one. Yep. So something like that. All right. So clamp. She's going to take her Metzenbaum scissor, and she's going to cut right in the middle. Yeah, just go all the way through. Yeah, sweet. Okay. Clamp, cut. Okay. And so now we're going to use a free tie or a suture ligature. A free tie, aka suture ligature, is any suture material without the needle attached to it. Okay. What's the OR sign for free tie? It's this. Dragon claw. Right? Okay. Now, there are hand signs that we use in surgery. I'm not going to tell you. You're going to figure it out. Ready?
Free tie.
Touch your needle.
Stitch, right? Or suture needle, all right?
Cut.
Scissor, okay?
Hawk.
Clamp.
Forceps, either like that or like this, all right? Forceps, okay?
Retractors.
Yay. That's
Good
it.
job.
All right, yeah, really, I'm demystifying it. It's not that complicated, all right? Free tie, cut, forceps, stitch, retractor. Now this is one retractor, this is 2 retractors. Okay? Now, tech tip. Only thing we have to be worried about is what hand is asking for what. Because sometimes you might see this.
Scissor and forceps.
But what goes where?
Scissor, forceps.
Scissor was in this hand, forceps was in this hand. Okay. Now, why is that important? Sometimes, especially when we're dealing with a bigger wound. So has her head focused here, right? So look in the wound, right? And give me a hand signal, right? So scissor, forceps, okay? Because she doesn't lose sight of what she was working on, right? But those are the hand signals, all right? Cool. So let's talk about it. So now we know, per our reading in the book, is that our free ties come in preset lengths sometimes, right? 18 inches, 24, Jesus. 18,
I gave you 2.
18, thank you. 18 inches, 24, 36, whatever the case may be, right? Our suture ligatures can also come in a reel. A reel is a little disc with one long strand of suture wrapped around it, okay? If you have a reel, how do we have uniform size suture lengths to give? We're gonna go the width of our mail stand, okay? So what we would do is take our reel on one end, unroll it to the other end, take our scissor, cut, uniform lengths every single time, right? Don't go the length, because you're wasting too much, okay? If you go the width, this is perfect. Right now, this is just for if you have the reels, right? And you're trying to figure out how to give them the same length every time, okay? Now, on the preference card, it'll tell you, okay, I want the 2.0 silk ties, 36 inches, or whatever the case may be. It'll tell you, right? So, now, how do we, remember how to tie? I'm gonna show you. All right, cool. So when it comes to tying, here's how we're gonna do it. So just hold this. So what Kaylin's gonna do, she's just going to show me the tip. She's not gonna pull. She's just gonna point this up just like this, right? So she's got that. All right, I'm going to go underneath the tip of her instrument, and she's gonna bring this straight up and down just like this, okay? Here, she comes straight up. I'm gonna wrap this around, and now what she's gonna do, she's gonna take this and turn it so I can see the back of it. Okay? Because just like that. Because I want to make sure that I'm away from the tip and I can tie this off, right? Then I will do my tying technique and I'll put anywhere from 3 to 5 knots in it. Okay? All right, so I'll do this one, you do the next one. Okay? So I'm here, she comes straight up, I wrap it around, she sews me the back of it. Excellent, right? So I'm here. Cool. All right, so she has this here. All right, so now let me show you how to cut suture. You can take your suture scissor, okay? 2 ways to do it. Number 1, take my scissor, slide down to above the knot, angle it, and then cut, okay? Don't cut the knot, all right? Slide down to the knot, angle it, cut. That's technique number 1. Technique number 2, Dr. Kayla is gonna take her finger and put that above the knot or on top of the knot. So now I slide down to her finger, now turn and cut, okay? Now, the doctor will do this to make sure that we have enough length so that it doesn't unravel, and 2, that we don't cut the knot, okay? All we have to do is just slide down, angle, and then cut, okay? So, what do you want to do? All right, so slide down, boop. All right, and then this comes off. All right, cool. Now the next one, this little piece right here, that would go in my little trash bag, okay? Now the second one, she's gonna do, all right? So, make the signal. Now, to pass this, she makes the little dragon claw. I'm gonna put it in just like this. Okay, one more time. There you go. All right? So now, I'm gonna show her the tip. She comes underneath, I come straight up. She wraps it, no, wrap it around that way.
Okay.
Nope. Okay, and give me 5 knots. Under pressure, doom, 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 doom.
I haven't done that.
Under pressure. Why not? Now, tech tip. The stuff I show you, practice, because you never know when you might have to use it. She's drinking the hell of this tissue.
It's not going anywhere.
So does the doctor do the free tie, or do we actually get to help with the free tie?
The doctor's going to do it. Now, in some cases, you didn't hear from me, but in some cases they'll ask you, hey, do you know how to tie? Especially if they're putting in a whole bunch. Yeah, okay, cool. Start on this end. I'll start on this end, we'll meet in the middle. Sweet. All right, so now
That wouldn't be like
I
that.
give this to the doctor. Now she's going to slide down to above the knot, angle it, and cut. Sweet. Okay, and we take that off. Now, doctors will do that. Okay, I'll just take that, I'll put that in my trash bag. All right, doctors do this shit all the time. All right, now, typically, it'll take 2 or 3 rotations of that to take down the mesoappendix, old school. Okay, now a faster and more expensive way of doing this is there is a stapler that is designed for omentum and mesentery that I can use to go through this like butter, baby.
Why would it be more expensive?
Because it's a stapler, right? No, seriously, right? So it's a religion based in Utah.
I literally remember you guys talking about this yesterday.
LDS.
Who?
LDS, the Latter Day Saints one, right?
Okay, but the stapler is
Is the
Is it like
Linguine?
a linguine?
Something.
Ligating,
There it
dividing
is.
the
sequence.
light
There it
getting,
is.
I can use the light getting dividing stapler. Yeah. So to use the light getting dividing stapler, right? So here's the omentum. So I would take Kelly clamp. I create a hole here. Create a hole on the other side, and then put the divider in the middle. Chunk. Squeeze it, and done, and we'll just zip right through this. All right. So, but there you go. All right, and then we'll take down the mesentery. Okay. All right. So, let me just get that out of the way. Sweet. Okay. All right. So now we've taken down the. So we've taken down the mesoappendix. Okay. Now we're ready to crush the base of the appendix. Okay. Which means now I'm here. Okay. So you see how we went through our instrument in order of use, right? It makes it so much easier for you guys when you do that. So I give Dr. Kaylin, I'm going to show you, but you're going to actually do it. Okay. So I'm going to give Dr. Kaylin one of these at a time. The first one she's going to crush. She's going to crush, and put the first one at the base. Okay. The second one she's going to crush, and then put the second one slightly above her bottom peon. Okay. No, you're gonna crush from here down. All right. So crush. All right, and then turn this up so you can see the tip.
What's the reason for the crushing?
It's a good question. Oh, so you got the. We just want this guy right here. All right, cool. All right, so that's the first one. I don't know the answer to that right now, but I will research it and get back to you.
Does this one face down when I clamp?
So no, this one's going to be in the same direction, all right? So you're going to crush, and then
Easier to.
yeah.
Chop through.
All right, so you can go like right about there. All right. So crush. So now this is going to be the stump of the appendix. Crush, and this we're going to place this a little bit higher, and we're going to cut in the middle. Okay. All right. So up until this point, okay, our case has been a clean case, right? The reason why is our appendix has not been ruptured, right? And there's no spillage of our intestinal contents, okay? But what we're going to do now is we're going to create the dirty portion of it. All right, so remember, we're both getting a glove. She has on 2 pairs of gloves. I have on 2 pairs of gloves. Okay, so I'm going to bring the blade over and set this down again. Now this is our neutral zone. Okay, the rule for the neutral zone: 1 hand in, 1 hand out. Okay, so what she's going to, I'm going to show you, but you're going to actually do it. So what she's going to do, okay, she's going to hold this up with 1 hand. With her other hand, she's going to go from distal to proximal on top of the bottom instrument. And she's going to cut this or resect this all the way to the tip, okay? Never, ever, ever cut towards you. Always cut away from you, okay? So she's gonna start here, slice, 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 slice. Now, when she's done, the blade, the peon, and the Babcock is all gonna go in here, okay? Go for it. Oh, she was ready for that shit. You see that? So I'm just gonna hold this for her. Okay, cool. All right, so now this goes in here, okay? I'm gonna set this off to the side, but we're not done yet, okay? All right, so now we have the stump of the appendix, okay? Now this is where our suturing technique comes in.
Purse string.
We're gonna do a purse string stitch, all right? So now I'm going to come over here to my back table, and this is why I have my suture preset, okay? I'm gonna grab just my suture and a forceps, and I'm going to take, now, my hands are clean. I have not touched any of this stuff, okay? So I can take this and just set this off to the side, because we're gonna need this. I'm gonna pass this to Dr. Kaylin, all right? She's gonna take that, give this to her. This goes in my trash bag, okay? I'm going to cut the suture. So I'm gonna show you, but you're actually gonna do it. So on the purse string stitch, okay? So all she's gonna do, so let's say this is the cecum. She's gonna put a stitch here. She's gonna put a stitch here. She's gonna put a stitch here on the other side. And then I'm gonna lift this up, and she's gonna put a stitch behind it. Kind of like that Crown Royal bag look. Right, so we're putting a stitch in a circle around the stump, okay? And then once she has this around the stump, she'll pop the needle off, and then we'll get ready to tie it, okay? So, you ready to do this?
Yes.
Do you want to do it, or you want me to do it?
I can do it.
Nice. All right, there you go. All right, so, all right, go for it.
So below this.
Yep. Come on in here. All right, yep.
Can I do that?
Yeah, go for it. Look what I can do. All right, so she's gonna put one right there. Yep. Yep, and then reposition your needle. She's so excited. She's like, can't wait to do it. Slide the needle holder that way. You're right about there. Yep. Yep. Yep, go for it. You got it. All right. And then the last one. Nicely done. Give it up for Dr. Kaylin. All right, cool. So that's the purse string stitch, right? So she's gonna pull this through, okay? Something like this. Let me get this going a little bit. All right. So let me show you how to take this needle off quickly and easily, okay? So where the needle and suture meets is called a hub, right? So the needle is just simply crimped into the back of the needle, right? The suture. What you're gonna do, take a needle holder. I'm going to clamp this right where the hub is. Okay? Right where the hub is. Okay? Once I have it clamped, simple twist. It should not be any harder than that to take this off. If you got a tug on it, you're not at the hub. Okay? So, now what I'm going to do is take my needle holder. I'm going to clamp just the tip of my needle. Okay? Lightly run your thumb over the top. If you feel something sharp and pokey, stop. All right? So, just clamp, cover the top, and then take my needle holder, and now that goes in there. Okay? So, this part I'm going to do. So the tech is going to have the stump. So just like this, okay? And tech's going to hold it just like that. The doctor is going to get ready to throw the first knot. So I'm going to get that knot ready, but I'm not going to cinch it all the way down. Okay? So what's going to happen now is, oh, and this is in here too. Right? This is in here. Oh, no, it's not. My bad. So this is in here, and my forceps is in here. Okay. So I have my first knot ready to go. Okay. So Kaylin is going to hold this up just like this. Okay. I'm going to tell her. So I'm going to tell her to push it in or invert. So she's just going to push this in, just like that. Now, when I say take it off, she's going to take it off. Not yet. As she's taking it off, I'm going to cinch this down. That makes sense? All right. So let's go back to the beginning. All right, let's go ahead, push it in. Okay, ready? Take it off. All right, cool. All right, and then she'll take the scissor. All right, so what's going to happen is, okay, so here's the stump, right? Put our purse string around it. She pushes it in. I say take it off. It's going to end up looking like this. Okay, so this is the cecal tissue. The stump is buried inside that cecal tissue. All right. So once we're done, we're going to cut. Yeah, slide down to the knot angle. All right. So now this goes in here. All right. This goes in here, and this goes in here. Okay. So once we're done with this, okay, now we're ready for our specimen. Okay. What are the 4 questions when we deal with specimens?
It's how, no, can,
What?
what, can, oh,
What?
I'm all
What?
jacked up.
What? How, can. Okay. Those are the 4 questions whenever we deal with specimens. Okay. What is it? How do you want it labeled? How do you want it sent? Can I give it to my circulator or put it on my back table? Okay. So here's what's going to sound. So the tech is asking the doctor this. All right. Doc, what is it?
Appendix.
Okay. How do you want it labeled?
Appendix.
How do you want it sent?
Fresh.
Okay. Now, so how do you want it sent? That means to pathology. All right. So Dr. Kalin said fresh. That means this is going to be placed in a specimen cup with no preservative. Okay. Now, if she had said permanent, then this will be placed in the specimen cup, and the circulator will come after the case and put formalin inside that specimen cup. Okay. Can I give it to my circulator? Put it on my back table.
Back table.
All right. So, if it's back table, I'm going to find an empty spot. Set this right here. Okay. Now, quick tip. I need to remember what's in my emesis basin. Real quick, everybody close your eyes. All right, Sean, give me one item in the emesis basin. Just one.
I'm blanking on them.
Pass.
It's the Babcock.
Okay, open your eyes, Sean. How many Babcocks?
1.
Okay. Sherman, give me one item.
Suture scissor 1.
All right, open your eyes. Jennifer, give me one.
Peons too.
Open your eyes. Joanna, give me one.
The blade. One blade.
What blade was it?
115.
Open your eyes. Dr. Kalen, that blade's on what handle?
Number 3 handle.
Open your eyes. Give me something. Joey, don't
I'll put it in. Coker. No?
Mhm.
The free tie.
Oh, that's so cheap. Open your
That's
so cheap. Go ahead.
It's one of the things.
Oh, no, nothing else is left in there?
No, there's more stuff in there.
Oh, okay. I was gonna say the
The Cobra Oshner?
Yeah.
Mhm. So, we had the needle holder. We had the needle, right? We had what forceps?
Russians.
We had Russians, right? So, I said that to say this, okay? Because those instruments are dirty, I can't touch those. So, at the end of the case, right, when we're counting, I can't reach in here and grab that stuff. That's why I need to remember what's in here when it comes time to count. Does that make sense? Okay? So, once I take my dirty instruments and just find a spot away from my other stuff, okay, I'm going to take my first 2 lap sponges and I'm going to put those in my kick bucket, okay? Normally your kick bucket is going to be off the edge of your bed, okay, within 1 arm's reach of your mail stand, right? So it would be right here, and then I would pass these off to my circulator. Circulator, passing off 1, passing off 2 lap sponges, okay? So I get rid of those, right? I'll just put these here for now, okay? Next, Dr. Kalen and I would back up, okay? Now we're gonna take off our gloves. Glove to glove, skin to skin, and put that in the trash can, wherever that is, okay? I'm gonna come over to my table now, and I'm gonna grab a towel, if I have an extra one, just put it in water or saline, doesn't matter. I'm just going to wipe my gloves, right? My second pair of gloves, okay? The reason why I'm doing this is I wanna make sure that there's no powders or anything like that on my gloves, because, and you just put that on there, you know. So the reason why we're gonna wipe our gloves is sometimes you're gonna be working with powdered gloves. I don't wanna introduce powder into the wound because that could cause an SSI, surgical site infection, by doing that, okay? Now, even if you're working with non-powdered gloves, it's just force of habit. Just wipe your gloves anyway, okay? So, once we do that, now we can both safely approach the field. I'm gonna bring up my 3rd lap sponge and just have that here just in case or whatever.
So
Okay?
that last time you just took off the first pair of gloves, you didn't?
That's
Okay,
it.
so you're going glove to glove, glove to glove.
Well,
Okay,
I'm going glove to glove, and then my clean glove, it's going underneath my dirty glove
Okay,
to take that one off.
got it.
It's still the same movement, but I'm
Right.
just taking off the first pair of gloves. All right?
Because I got confused when you said skin to skin, that's awesome.
Well, that's what
Yeah.
I'm doing, but you
Alright.
get the idea.
Yeah.
All right. All right. So now we're ready to irrigate the wound. Okay. So I'm going to bring up my pitcher of saline. My saline is going to have an anti-bacterial, antimicrobial additive to it. Typically, it's bacitracin. It could be Ansef, Keflex, whatever the doctor wants. That'll be on the preference card. Okay. I'm also going to bring up my pull suction tip. Okay. I'm going to put this here. The doctor can easily grab the asepto syringe while I switch suction tips. Okay. So she grabs that. Okay. And we're going to tell anesthesia that we're about to irrigate. The reason for that is the amount of fluid affects the EBL, or estimated blood loss. Okay. Also, at the end of the case, the anesthesia is going to ask you how much fluid did we use, right? Pop math quiz. If I use 2 full asepto syringes, how much fluid did I use?
240 ounces. 240.
240 cc's or 240 mLs. How do you know that? 60 in the bulb, 60 in the syringe. CST question. All right? 60 in the bulb, 60 in the syringe. All right? You're absolutely correct. All right, so she goes it, don't do it. Our suction does work, but we're not going to use it today. Later on we will. All right, so she then suction, 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 all right? And then we'll go ahead and suction this whole thing out, okay? Whenever we're working deep in the abdomen, we use the pull sucker because the bottom third can be occluded by tissue, and I still have all of these holes here to suction everything else out. Versus, if I use the yank hour, same scenario, it's going to be occluded because the tip of the yank hour, you may have a total of 5 or 6 holes total, okay? And one more time, if I have a large volume of blood or fluid I need to suction, I'm going to use the pull sucker. If I have a small amount of blood or suction, I'm going to use the yank hour, okay? So once we're done suctioning, I'll switch suction tips. Last time, I'll take this and just put this on my back table, okay? All right, so here comes the difficult part for most new techs, because now it's time to close the wound. The procedure's over, right? Now we get to close, all right? So, which is why you want to have your sutures in order of use. So again, how I see it, the suture closest to me is for the deepest tissue layer. So in this case, peritoneum, muscle, fascia, subcu, skin. Okay, these aren't the correct sizes, but you get the idea. That's how I look at it. If it makes more sense for you to look at it from skin to peritoneum, that's fine, right? It's the same thing, right? Essentially, right? But again, even if I brain lock, I can still look at the bottom suture and know that's the first one. Does that make sense? So again, almost like cruise control, all right? So I'm going to pass the needle and forceps to the doctor, okay? And we will start to close, okay? Now, depending upon the speed of the doctor, we should be done with all of our counts before she closes this wound, okay? Now, in order to help you have a fast counting, you got to be orderly. I didn't say neat. You got to be orderly, right? So you don't want to have a junkyard of instruments on your back table. You don't want to have on your nail stand. You don't want to have a messy back table. All right. So when we count, there are 3 areas that we count in this order. The patient is the field. Next is your nail stand. Next is your back table. In that order, always. Field, Mayo, back table. Okay? Now, in the beginning, it's going to become monotonous. Field, Mayo, back table. Field, Mayo, back table. Okay? The reality is, in the real world, you're going to count it where it is, but we aren't there yet. Okay? So, for now, until I say otherwise, field, Mayo, back table. All right? So, let me give you an example. All right? So, a couple of things. I'm going to load the first suture, right? I'm going to give that to Dr. Kaylin because she's awesome. And I had a wonderful time. Thank you. You were my first and I feel wonderful. Creepy. All right? He's like, the fuck?
What does it say, dude?
All right? Anyway. All right, so now, tech tip. Take your scissor, all right, I'm right-handed, put it on your ring finger, all right? You're gonna hold this like this, okay? If and when, so periodically you're gonna say cut,
Okay.
all right? If she says
Cut.
flip, cut, back to this, all right? All right, that way I can count, and say cut again.
Cut.
Go back to what I'm doing, okay? Instead of, all right, count, say cut.
Cut.
Oh, okay. All right, it's pain in the ass, right? So get used to putting this on your ring finger and kind of holding it like this. All right, so that way all you gotta do is just go from here, flip, cut, and then go back to here, right? Back to there, okay? So let's go through counting a few items. You guys get the gist of how we do it. So we're gonna go, so we always start with our small stuff first, and we always start with our laps first, okay? So we're gonna go through the lap sponges, right? So Aspen is my circulator, and she says laps. Okay? No, you're fine. Yeah, I already did that, all right? So she says laps, okay? I have 1 on the field, none on my Mayo, 2, 3, okay? I only count what's sterile and in these 3 areas, okay? 1 on the field, none on my Mayo, 2, 3, circulator would come over, number 4, number 5 in the base, in the kick bucket. Okay, you guys all see that? Okay, all right, what's next? So as we're doing this, she's closing, okay? Say cut. Come over, cut, right? We'll keep rocking and rolling. All right, so Ratex, again, none on the field, none on the Mayo. I have 1 on my sponge stick, all right? Yeah, now I'm making sure that she can see, okay? So if I'm standing here, she's gonna come over here, all right? I have 1 on my sponge stick, okay? Now I'm standing here, okay? Why? I can see her, she can see me count, and I can see what's going on here, all right? That makes sense? Now I don't wanna do this because now I can't see Dr. Kaylin, and then give me the scissor cutting sign, Kaylin. If she's giving me the scissor cutting sign, I can't see it, right? Which means she's getting pissed. Why? Because I'm not paying attention to her. Does that make sense? But if I stand here, now give me the sign. Okay, real quick. There you go. All right, now I can go back and do it. Okay? You want to stand so you can see what's going on here, and you can see what's going on here. Okay? So, none of the field, none of my Mayo. Sponge stick has 1, 2, no, I'm looking both ways, right? Right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? Now, you guys get the idea? And then we'll go through the entire count that way. Okay? This protocol is going to be the same for all of our instruments as well. Okay? So, and again, if you know your instruments and your needs, it'll be a lot easier to get through this stuff. So, let's count peon clamps. Just say peons.
Peons.
All right. None on the field, none on my Mayo. I have 1, 2. I have 1, 2 in my dirty basin. All right. Again, I can't touch this because they're dirty, but I know what's in there. Does that make sense? Just random discount Babcocks.
Babcock.
Right. I have none in the field. I have 1 on my mail stand. My second one's in the basin. All right.
Blades.
No, we do the small stuff first, and then we count instruments.
Okay.
I was just giving you guys examples. Okay, that makes sense. Okay, so technically, we're going to do 4 counts in every case, right? Well, per the book, we're going to do 4 counts. Okay, at the beginning of the case, we're going to do what's called a full count. Now, a full count is all of your small stuff. Okay, and all of your instruments. That's a full count. Okay, that's count number 1. Count number 2 is when we are closing the deepest tissue layer. So in this case, when we do our peritoneum, we're going to do our second full count. And we're doing our second full count to make sure primarily that we haven't left any sponges or instruments in the wound. That makes sense? Okay, that's our second count. When we get to the subQ/fascia, now we're going to do a half count. Okay, and a half count is just our small stuff. Why? Because we know we haven't left anything deep. That make sense? And then once we get to the skin, that's our final half count. Again, small stuff. All right? Once we are finished with all 4 counts, I will tell the doctor, doc, final count is complete. Sponge and needle counts are all complete. Hopefully she says thank you. You're welcome. All right, cool. All right, so we're gonna do 4 counts: 2 full counts, 2 half counts. Okay? First full count, 1 second. First full count is before the case starts with the circulator. The second full count is at the deepest tissue layer closure. Okay? The first half count is right around the subq/fascia area. And then the last half count is at the skin closure. Yes?
What is the circulator saying to you the whole time? I know, like, when you get the right amount, she'll just say correct, right? Or recount.
Okay, so now normally she won't say anything if it's correct,
Okay.
because you have it all. Okay, now if there is a miscount or an incorrect count, she'll say miscount or do it again or something like that. Sterile. Right now, if you're counting something, so let's say we're counting lap sponges, right? And I'm counting, and she says miscount.
Miscount.
Right? Go back to the last thing you counted. Right? So if I'm counting lap sponges, and then I'm trying to count the Ratex, and she says miscount, go back to the last thing you counted, which was the lap sponges, and count those again. Right? Same thing for your instruments. Right? So if I'm counting my Kelly clamps, right, blah 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 blah, and then I start on my straight Kellys, and she says miscount, go back to your Kelly clamps and count those again. Okay? That as a general rule. Or the circulator will just tell you, no, count your Kellys again. She'll communicate what needs to be counted again. Right? But as a general rule, if she says miscount or something's not right, just go back to the last thing you counted and count that again. Okay? Any other questions? All right, cool. All right, so we're working. It's like Sally from A Nightmare Before Christmas, but it's all good. It's all good. All right, but give me a flavor. Get that yellow. So you can do it. It's not at the hub. Nope, you got too much of the needle.
She's nervous.
Alright, so pause. You see how she's trying to pull on it? You shouldn't have to do that. It's got to get right at that hub. Right at that hub. Get too much of the needle. Don't make it from where I didn't show you. Alright, so pause. You see how you have a little bit of that needle there? Nope. It's got to be right at that hub.
I know what I'm doing, it's just not there.
Oh, do you? Alright, so stab myself. Alright, so gather around. So you want to get right at where the needle and the suture meet, right? So here's the end of the needle, here's the suture. You want to be right here, right? And then it's just okay. If you're not right where it meets, right where it's crimped, then you're gonna have to tug on it, and there's no need to tug on it. If you're right where you need to be, it's just a simple twist. Okay, and then take your needle holder, cover just the tip of this lightly, then we're good to go.